Welcome to Beneath the Surface, the podcast dedicated to helping you navigate life pressures with greater ease. I am your host, Obinna Okeke, and today we're diving deep to the understanding of migraine, their root cause, their impact, their particular tools that we can use now to mitigate against migraine. Migraine is a complex neurological condition characterized by recurring headache, often deliberately accompanied by sensory disturbance. These kind of headaches are very, very severe. It affects roughly 1 billion people worldwide, making it a common disabling disorder. Beyond headache pain, migraine can impair daily functioning of disrupted work, school performance, and diminishing quality of life. So, what is this migraine? Migraine is not just a headache, it is a clinical disorder involving changing in brain activities, blood vascular, and pain pathways. Typical migraine attack unfold in phases: prodromy, activity, blood vessel, and pain pathways. The prodromy could include mood shifts, neck stiffness, or food craving a day or two before pain onset. Aura affects roughly 25% of migraineurs and consisting of various and sensory symptoms that last up to an hour. So migraine, as you can see it, is a very delicate disease that affects our brain. It affects the way we do things. It affects the way we operate in daily activities, especially in our workplace or in school or when we get home. During the headache phase, pain is often unilateral and moderate in severe intensities. Activities such as walking, climbing stairs worsen the discomfort. Nausea, vomiting, light and sound sensitivity are sometimes dizziness accompanied by pain. So, let us dive into the causes and risk factors of migraine. Migraine arises from the interplay of genetic disposition, environmental trigger, or neurological changes. First degree relative of migraines are 2 to 4 times more likely to experience migraine, highlighting a strong hereditary component. So what do we mean by this? If you are a sufferer, or your father or your parents are sufferers, you are 2 or more or 4 times more likely to experience migraine in your life. So it's a hereditary component. Researchers have identified several genes variably linked to the icon, channel function, and neurotransmitter regulation and vascular activities. So, common triggers that are concerned with migraines include environmental and lifestyle factors, moderated migraine susceptibility. So, the environment in which you are in can be a very big factor to affect the way migraine comes to you. So, hormonal fluctuation during menstruation, pregnancy, and menopause are also very big factors that can trigger migraine. Dietary factors such as caffeine withdrawal, alcohol, or aged cheese. So, if you drink a lot of coffee that had so much caffeine, so you are more likely to be susceptible to migraine. So what do? We have to stay away from too much coffee and alcohol as well. So the people that eat too much aging cheese can also stay away from that. Sleep pattern can disrupt while sleep deprivation or oversleeping. These are also contributing factors that involves in what migraine or severe headache. Stress, both acute and chronic, which alters brain chemistry, can be also a common trigger for migraine. Sensory stimuli like bright light, loud voice, or other strong odors can also be a common trigger for migraine. So let's move ahead. Effects and impacts. The burden of migraine, well beyond this epidemic pain in between attacks, may individual experience anxiety about the next striking when the migraine will come. So it impairs our concentration and our productivity. So frequent sufferers, those with more than 5 or 15 headaches per day, face high risks of depression, medication overuse, and social withdrawal. So if you suffer so much migraine, there is more likely the chances of you staying away from the public, because when it comes, it becomes so severe. And when it becomes so severe, you're most likely to be staying more at home than getting yourself socially involved in the public. So migraine can also impose an economic cost to individuals and society. How do we say this? The people caring for you would also be around all the time to help you to deal with this. This will impose economic costs on the individuals and then the society as well. For example, the NHS. A single severe attack can lead to absenteeism, so you stay away from the public, or reduce productivities at work, costing employers an estimate of several thousands of dollars or pounds per affected individuals per year. Healthcare expenditure rises with emergency room visits, specialist consultation, and image studio, for example, frequently to doctors or healthcare professions. This can be another cause for so much migraine. So, on a personal level, chronic migraine can erode relationship, limit recreational activities, and trigger feelings of helplessness. You feel like you can't be able to help yourself because the migraine is too much, and nobody wants to suffer a kind of disease that, would affect him so much. Diagnosis of migraine. Acute diagnosis rely primarily on clinical history guided by International Classification of Headache Disorder called the ICHD-3 criterion. Physicians look out for 5 attacks fulfilling specific features. So let's start with number 1. And again, you have to be mindful of this in case you're having headache. This is how you know exactly that you're having migraine, which is an extreme form of headache. So first symptom is that headache lasting from 4 to 72 hours if untreated or unsuccessfully treated. That's number 1. So number 2, pain with at least 2 of the following qualities: unilateral location, moderate or severe intensity, or aggression by routine activities. So you look out for 2 of these symptoms. So when the location is permanently on one side and is getting so much, or the quality of the headache is so severe that you can't bear it. So sometimes it comes very moderate and it comes very intensive. Aggression by routine activity. It comes with a routine form. Maybe every 2 hours it comes back. During these headaches, at least one of these, look out for this, is vomiting, photophobia, or phonophobia. So nostril vomiting. So sometimes it gets so bad that you have to vomit, you have to be seeing things, you have to be imagining things in your head, and this is part of the symptoms you have to look out for. Neurological examination is normally between attacks. Imagining studies such as MRI or CT scan are reversed for red flag features, sudden onset, focused neurological defect, signs of this infection. So, prevention strategies. So, preventing migraine attack involves both lifestyle modification and pharmacological intervention. Lifestyle measures aim to stabilize sleep, diet, and stress level. Number 1, maintain a constant sleep and wake times, targeting 7 to 9 hours every night. This is absolutely important if you have to stop a migraine. So you have to maintain a constant sleep pattern, targeting at least 7 to 9 hours every night. Follow a regular meal schedule. Avoid non-dietary trigger, something like too much fat, too much daily food that can cause migraine. Practice stress management techniques. In conclusion, migraine is a prevalent neurovascular disorder with profound personal, social, and economic consequences. Thorough understanding of the distinctive phases and diagnostic criteria guide appropriately in intervention. Prevent hinges on lifestyle optimization and evidence-based medication, while acute treatment leverages both traditional and novel therapy. Would be a very, very nice opportunity for you to have this treated. So you go through traditional leverages for what? For the treatment, and then a novel therapy. I always recommend this therapy because it's so good. Check yourself, make sure you go regularly to doctor, and make sure that the doctors conduct appropriate care for you to make sure that all these things are properly taken care of. Case studies and real life examples underscore a value of personalized care, identifying the triggers, tailoring prevention strategy, and integrating non-drug modularities can be a very good helpful for us when it comes to migraine. So, empowering patients through education and precise diagnosis and collaboration treatment planning transform migraine from an unpredictable burden into a manageable condition. So if we have educated people that are involved in the treatment of migraine, it will help to reduce the burden to a manageable condition. As research is advancing genetics, the future holds promising for even more effective migraine control. Continuously learning, open communication between patients and providers. A holistic approach remains the cornerstone of improving life for the living in migraine. So that brings us to the conclusion of this migraine, and I hope you stay safe out there. Please don't forget to subscribe. Don't forget to like this video. Please always tune into our channel. Stay safe out there. I remain your host, Obinna Okeke, and this is Beneath the Surface. Thank you so much.